Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital director. Today is the update from Albany Medical Center on the coronavirus. Today's Incident Command Day 39. We are reporting in the 5 surrounding counties there are 1,252 patients who have tested positive for COVID-19. That's an increase only of 2% from the day before, and it's important to note now there are more additional outpatient testing sites. We read this morning that there's 4 more sites coming online. So while we may see that number go up in the next couple days, we didn't see it go up too much from yesterday. Inside here at the medical center, we currently have 61 patients who have COVID-19. That's the same number that we had yesterday. The breakdown is we have 32 on the floor, we have 29 in the ICU, and we have 20 on the ventilators. Now that's important for a couple reasons. The first is that the 20 on the ventilators is the lowest number we've had in a while. We've been very successful in getting many patients off the ventilator and on their way to rehab, which is wonderful. We also had 6 patients who were admitted to the hospital. We had 3 patients who were discharged from the hospital, and we had 3 patients who, I'm sad to report, have died. This leads to a conversation about some of the things we're doing to help in those particular situations. It's called palliative care. Fred?
So palliative care is actually a very unique specialty within medicine. And these are physicians that are trained to have those very difficult conversations with family and patients and shepherd them through that end-of-life discussion and frankly, very often end of life. We're very fortunate that right now we have 2 palliative care folks. Joanne Porter, who's actually one of our pediatricians. Joanne runs the Journeys program, which is palliative care for children. Fortunately, she hasn't had to use her expertise with any children, but she's stepped up and is helping us on the adult side, really taking families through those difficult conversations. And the other physician is Mike Jones. Mike is a family practice physician from Columbia Memorial down in Hudson, who also is fellowship trained in palliative care. Mike's on loan from us, helping us, again, working with families, getting them to understand what's going on, helping to set up the right kind of care for their patients at end of life.
And those physicians are often partnered with social work, pastoral care,
Yes.
other disciplines who help with that whole process.
Our ethics group, there are a whole bunch of other folks involved, and they all play critical roles in determining the right care path for those very, very sick patients.
Okay. Let's talk a little bit more about those 61 patients who are in the hospital right now. I'm very pleased to report there are no children currently in this hospital being treated for COVID-19, and there are no pregnant women either. Of the 61 patients, they're currently being treated for on 6 different units. There are 2 floors, C2 and C4, that are med-surg floors, and there are 4 different ICUs. There's a coronary care unit, there's the medical ICU, and there's D3 North. And all 3 of those ICUs are very heavily involved in treating COVID-19 patients. There's one other unit I want to talk about in a second. But what's important on those 6 units is that they're taking care of the COVID-19 population. Fred, how many units do we have in the hospital right now?
We probably have 30 units functioning right now, Dennis. Usually we run more than that, but we have closed some of the units as the volume has gone down in the hospital.
So the 6 units are representing where the COVID-19 population is being cared for primarily. We may have 20 or 25 other units that are caring for non-COVID-19 patients.
That's right. And we're very careful not to put COVID-positive patients on those units.
Very good. The 4th ICU that is taking care of COVID patients is CPS. We spoke yesterday about how we have 2 different patients on ECMO. And Fred, I think you want to give us some more information about that.
So I'm actually wearing a CPS jacket today, so shout out to that group. CPS is our cardiopulmonary surgery unit, so this is typically where the open heart patients go after they've had surgery or other large cardiac or thoracic procedures. Facilities actually created a negative pressure space there. They put up a temporary wall. It's really quite remarkable. We looked at it yesterday. And on the other side of that are several rooms where patients with COVID infection can be safely cared for without transmitting virus to any of the other patients or any of the other staff on that unit. So there are 2 patients there right now, and we've heard that they're doing a lot better on ECMO. One of them has actually received the plasma transfusion from a member of our staff, as we talked about the other day.
And as we mentioned, the number of donors who are able to give their plasma, convalescent plasma, we started with 1. we reported that number was 5. Then we reported it was 8. And this morning we've heard we've had 18 different matches. And we're certain to believe that that number will be in the 20s very soon. So again, thank you to everyone who's been able to donate. It's very, very generous of them. Let's talk about healthcare workers who are exposed. We've talked about this in the past. We've been very transparent how many members of our workforce have gotten COVID-19. The number currently is 82, excuse me, and I think the majority of those have been picked up outside the institution, but now we're able to report about how many of those have come back to work.
So Dennis is absolutely right. 3/4 of the infections have occurred from community exposure, not exposure here within Albany Medical Center. And of the 82 that tested positive, 41 have been cleared to come back to work.
That's great.
So that's really tremendous. Very few of them required hospitalization, none of them in our intensive care units, and none of them ventilated.
Excellent. Let's finish on masks. We talk about masks a lot. We want to talk about the 2 different executive orders that have come out this week. We spoke about the first executive order that the governor signed on Monday. That was a requirement for all employers of essential businesses to be sure that their employees had face coverings. As we've talked about, within a hospital setting, that's a mask. More often than not, it's a surgical mask, not the N95 mask, but one mask or the other when they're taking care of patients inside this hospital. And we're following that. We spoke yesterday about how we are going to be going through between 120 or 160,000 masks a week in order to comply with the executive order. There's a new executive order that the governor was talking about today that says that when people are in public, they also need to have a face covering if they cannot socially distance or be several feet away from a person. So the question, Fred, is does this new executive order change what we're doing here in the hospital?
No, Dennis, it doesn't. So the medical center, as we've talked about before, has suspended visitation. So the public can't come into the medical center unless they have a very specific purpose, they're a patient, or in the very small group of exceptions we have for visitation. So while in other circumstances this would be a public venue, it isn't at the moment. So the new executive order doesn't really affect us.
That's how we can sit here inside the medical center. We're socially distanced.
Yes.
We took our temperature when we came in, but we're not wearing a mask. We are not defining this as public space.
There's no one from the public in here, just you and I and the cameraman.
Okay, very good. So we wanted to clarify those 2 things, and of course we'll continue to talk about that as we go forward. I should mention I'm wearing emergency management. I was very excited to put this shirt on because emergency management is the way in which we've organized our incident command under the leadership of Scott Heller and the emergency management department. It's really how we've been operating now for these 39 days of incident command.
Absolutely.
So thank you to our emergency management department. That'll do it for today. Tomorrow's Friday. We always like to end the week on some good news, and I think you're going to hear some really uplifting stories tomorrow and some other great things that are happening here at the Medical Center. As always, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.